every treatment is individualized to the patient here. And so we look at our patient's skin tone. We have them fill out something called a Fitzpatrick, and any of you that are our patients know that that's that really confusing form that you have to fill out, and everyone's always like, oh, I'm not sure, what does this mean, I don't remember what the color of my hair was when I was a kid. That's a big one that we get. But we fill out the Fitzpatrick, and then that helps us set the proper settings for each patient. And so if the patient settings aren't correct, then you won't get a good treatment. And so this is what we're doing over here. So we take a look at our patients. We look at the skin tone and texture, and what we ask them what they want to treat, and so forth. Our patient here is concerned about. What's your biggest concern on your chest?
Mostly just a little bit of discoloration and a little bit of redness.
So Jen takes really good care of her skin, as you can tell. I mean, she is really good. She stays out of the sun. She's not somebody that really abuses her skin. And her chest is an area that she has just some tiny little brown spots on, a little bit of reds. But then as we concerned with the texture of the skin and the tone of the skin, and this is one of the things that the BBL does for the face and the body. It is amazing on skin tone and texture, and you end up looking airbrushed after these treatments, like 3 weeks, 4 weeks later, and especially somebody like Jen here who doesn't have a lot of damage, like she will look even better than she looks today, because it will look like I put a filter in the camera to look at the skin on her chest. Now, people that have sun damage, there's even a bigger wow factor, because then that sun damage is gone too. So, and like Alex had pointed out over here, these are real results. These are reproducible results. These are results that colleagues of mine are getting and that we're getting here at Sirena Medical Aesthetics. So this is a great, great treatment.
And guys, I'm going to pause you there right now to Jenine real fast. So for those of you just joining, thank you. This is Alex Akunzo with Saiton here at Sirena Medical Aesthetics in Waterford, Connecticut. We just finished up a Moxie treatment. They were the first practice in the state of Connecticut to offer the absolutely spectacular, non-ablative, low, no downtime Moxie. And we're about to dive into a BBL hero treatment. Guys, this is going to be our rapid motion skin rejuvenation treatment for addressing tone all over the body, sun damage, pigment, and redness all over the body and face. So Janine's just getting prepped up here, and we're going to dive right in. Want to turn off your sound on that? Thank you. It won't? Okay, that's fine.
Okay, so I'm going to get, eye protection. She's already been prepped and cleaned up.
What?
The AirPods?
No, it's fine.
I feel like once it gets going, it'll be...
Yep.
All right. So just as a side note, little plug here. If you check out her eyelashes, Jen is one of my favorite people in the world, and she actually owns a business that's local. That's called Swoon Salon and Spa, and she does an amazing job with eyelashes. She does everything that you can think of with eyelashes. She actually tinted and permed mine. I got a lash perm.
Oh, wow.
It's ridiculous, guys. But she does everything. So anyways, I got those tarantulas in there because she has beautiful, beautiful eyelashes.
This is just cross-promotion, firing on all cylinders. We've got patients, practices, eyelashes, skin rejuvenation. I love it. No. Oh, come on. Let's...
We have to give props to our women, especially women business owners out
Amen
there.
to that. I
All right,
love
so
it.
Alex,
Yes.
now this was a toss-up for me.
Uh-oh.
Like, red or brown? I went with red. What would you have said?
You know, so...
You
here's
would have said brown because it's going to treat the red too.
Well, honestly, for all our practices and operators out there, I always like to talk about how our cutoff filters work. So, even though when you're using 515 nanometers, you're still going to soak into deeper filters. So just because you're using 515 doesn't mean it's not going to soak into those lower conditions deeper into the epidermis. So, you know, if the primary condition is redness, you want to default to using by the book the 560 nanometers. But in this case, it looks like that's the primary condition, so you go for that. If there's both, most folks by the book and by our team are going to offer, yeah, they're going to say 515 for sure.
All right, guys. Like I said, don't blink here. We're gonna get this on for you, my friend. Now, one of the things is she has this really beautiful tattoo over here, which I'm gonna avoid. If you guys have active tans, if you have tattoos or anything like that, we'll have to keep those out of the field when you come in here. And I don't do these, and I'm very strict about this. I don't do any BBLs on anyone that's had active sun or is wearing self-tanner for about a month before the procedure. So I'm pretty strict. So sometimes we have a laser season here. It usually starts in September and it goes right to June, depending on how crummy the weather is here. All right. So here we go. So it's gonna feel like hot rubber, you know.
Awesome. So glasses on. Awesome, guys. Safety first. We always put our BBL glasses on. And you guys are going to see how fast this treatment goes. It is in rapid motion. She's going to finish this in a matter of seconds. It's spectacular. So Jenine, combined with this treatment.
I combine Halo or Moxie with this. I mean, on the body, on the neck, we routinely do Halo. Moxie, I'll do anywhere.
Mm-hmm.
I haven't done a ton of Halo off, like, past the chest, personally. But BBL, man, you can do it with anything. And I mean, routinely, you know, not even with other laser stuff. I mean, my patients routinely will get BBLs, and then they'll do other things like, you know, custom skincare packages. They'll do, you know, maybe some Botox or, you know, one of the other neurotoxins or fillers. But you can pair this with anything in our arsenal. And,
awesome.
And I have to say that the BBL itself is really the mainstay of most of my patients. Whatever else they do, their maintenance is always BBL. Always, always, always. So guys, we're done with that treatment. We're done with that.
Isn't that crazy? I mean, literally a matter of seconds. You know, don't blink. You're going to finish these treatments way too fast. Speaking of blinking, I know I have to do a little product shout out here. Jenine, are you cool with that?
Yeah, sure.
I love it. So we actually have these new, we replaced these guys. This is our OG glasses. We have new BBL blinks, which actually, that's going pretty fast, right? 4 pulses per second, blinking like that. They blink for you. Can you believe that?
So do I get a free one?
Yeah, let's pull a few more promos and then we'll talk offline about that. But you know, what can we say? We like taking care of our family members, that's for sure. So
I have to say, you guys, so you know, I've had other lasers in the past. I've had other boyfriends in the past, but the Sciton laser, not only does it deliver every single time that I use it, and I feel so comfortable in the science and just using the laser, but the support that I've gotten from the company, especially Alex, I have to give a shout out to him, has been amazing. It's been a game changer for us. And, you know, those of you that know our practice, we've had some stuff happen over the last year in the practice, and I have to tell you that Sciton has been so extremely supportive. And again, especially Alex, they have gone out of their way. I mean, there is just nothing that they would not do for us. And, you know, that is so important. And it's important. My laser was down one day, and I had something that day. Like, Alex brought something out, so I did not see patients that day. I got to continue to see my patients. They didn't have to reschedule. And this is the kind of service that we get. Not only is it an amazing product, but it's backed by amazing people. So
I love you guys. Seriously, I love you guys. You're so awesome. I appreciate you so much. You can't even begin to describe how awesome you are. And you know, it's great people like you that it makes Saiton great as well. So we'd be nothing without our providers.
Let's ask Jenny, what did you think of that treatment? You've had a regular BBL on your face in the past.
Mhm.
How did that compare? Because this was a little bit faster, right?
Much faster.
And how did it feel? Did it feel different? Did it feel better or worse, less or more snappy? You can be honest.
Yeah, so actually it was very comfortable. I barely felt it.
Excellent.
And just the swiftness of it was actually pretty impressive.
Yay!
Yeah.
I love
All
it.
right.
Yeah.
So the next time that we do the BBL on your face, we'll be doing it at that more rapid pace.
All
So,
right.
all right. Well, thank you for joining us tonight.
Thank
We really
you, guys.
appreciate it.
Yeah,
We
thank
love
you,
you guys.
everyone. Everyone, big shout out to everyone who joined us tonight. Huge shout out to Sirena Medical Aesthetics.
And I did promise people. So how many people are on?
Looks like, yeah, we got 14 right now.
So I did threaten that I was going to give something away.
Uh-oh.
We'll be giving away a Forever Body treatment. What do they
Woo!
have to do, Liz?
Ooh, what do they have to do?
Uh-oh, over to Liz. No pressure, right on the spot.
No.
Well, this is like, because I don't get the technology stuff, so this is how I can know that people were actually on, and I can give it.
All right,
proper
let's
people.
do. You gotta like the post when we post it.
Fair.
Comment. What
Comment just with your body, the body
the
part.
body
that
part you want
Keep
done
it
most?
clean, people.
Oh, yeah, whoa. Like, heavy asterisks on that, yes.
And comment with the body part that you want. Like, just say, arm, leg, whatever. It could be any body part within reason, guys.
Yes. People are going to use some wild emojis here. I love it.
So,
Yeah.
how's that sound? All right. So
Awesome, guys.
I'm
All
so
right.
excited to give one of these away.
Well, this was a blast. I want to say thank you to everyone. This is so awesome. Movie magic, 2 angles. This is a first for me. So thank you guys. An amazing night to do these treatments. Cheers to
Awesome.
Sirena.
Bye.
Bye, guys. Thank you.